Pete here from the Pain Toolkit, and hope you're having a nice day wherever you are and wherever you are. Do you know what? I'm really pleased to today to tell you I'm interviewing a really special lady. I met her a few years ago up in the northeast when I was doing a Pain Toolkit workshop for people with arthritis, and this lovely lady called Kim Littlemore from Pocket Medic. She was kind enough to come along and actually film the actual video, or film the actual parts of the workshop and all that, and edited it and stuff like that. Do you know what? She did such a fabulous job. Like, it's been on YouTube now and seen quite a few times. So what I thought would be useful of actually, do you know what? I'm going to turn the tables a little bit and interview Kim. She was interviewing me back in the day. By the way, she did a very good job as well. So good afternoon to you, Kim, and how are you today?
Me, I'm very fine, thank you. And you know, you say that, I don't think I've ever really been interviewed before, and certainly not on camera. It's something that mostly I avoid.
Do you know what? You're looking lovely, baby. So just relax, okay? Listen, I'm not one of these. Listen, you was really nice to me when I on the interview, and as others will tell you, I'm not a Rottweiler or nothing like that. You're not being interviewed by Piers Morgan or anybody like that. Listen,
I have to tell you, I have sprayed everything that I've got on my hair, on my face, and everything. I think everyone who's got any grey hairs lurking knows what it's like to have to kind of make yourself camera ready.
You look delish. Listen, I don't know. I know I keep seeing people now, especially you young ladies, with all worried about your hair and whatnot. I mean, I just see, as you can see, like I'm a slaphead anyway, and I sort of give me something, you know, shave my head anyway, just so to me, it's not a problem, like, you know. But I used to use that washing shampoo called Wash and Go, but it wash and went. But there you go, it's another story. Hey, listen, enough about me. I want to talk to you about what you do at Pocket Medic, because how you engage people, how you're getting the messages out there about all different types of long-term conditions. And I remember you telling me you're doing something around with COVID-19 on how you're supporting the local NHS organisations. Can we start off with that?
Yeah, certainly. So we've done two things. I've done some formal stuff. So Public Health Wales, Tech Cymru as it's called, came to ask me to help them to, you've heard about people having these remote interviews with their doctors, or not interviews, remote consultations with their doctors. And there's a piece of kit called Attend Anywhere. And it's a little bit like Zoom or any of these other things where you have a little URL, you click on it, and then suddenly, wow, you're sitting opposite your GP. So they needed to have ways of showing GPs how to use it, and also patients. So I made some films straight away for them to do that. And I think that was my last but one shoot before we were told we couldn't go anywhere. And I remember because the professor I was working with sneezed at one point in this room, and we were all sitting together. We were all feeling a little bit jumpy. And she sneezed, and I said, you are going to wash your hands, aren't you? I mean, now we know that really sneezing's not part of the COVID symptoms, but at the time we all literally sat there like this, terrified, because this poor lady had sneezed, and then we all stared at her till she went and washed her hands, which frankly would have made no consequence anyway. But anyway, that was my last but one shoot, and those films have gone off now to be used, which is great. And can
I just wind you back? So this video that you've made, this film that you've made, it's to help, it's like a noddy guide for healthcare professionals knowing how to use the technology, but also the patients as well. Have I got it right?
Yeah, that's right. So, and I think it's going to be used in Wales, because that's where I'm based. But I know Attend Anywhere is being rolled out in all sorts of parts of the UK. And it's funny because they've been talking about using it for some time. And of course, things really, anyone who knows, especially working in digital health, it's really, really difficult to drive change. But now change is being driven for us. So, you know, it's exciting, because I think remote consultations for all of us are incredibly useful. I mean, my mum had a skin condition. I was able to send the photograph by email to the GP who commented on it. We had the cream that same day. Why that hasn't been part of our operating system till now, but you know, unfortunately it takes something as terrible as COVID-19 to force that change, especially for people who are living with pain, who find it difficult to get to surgeries. You know, this is probably a godsend.
Well, I think on the TV I heard on one of the presenters saying that since all the COVID-19's been around, that attendances to GP surgeries has dropped by 50%. and I think even might even be more actually, and also a 50% drop at actual people turning up at A&E. So I think, like you, I mean, I've been doing remote stuff now for just nearly coming up to 2 years, I guess, and all my workshops now are online. And anyway, listen, today's not about me; it's about you. Listen.
Let me tell you about the hospitals then, because that's been very interesting experience. We had some clinicians who I've been working with to make the Pocket Medic film. So that's about COPD, respiratory conditions, and diabetes, type 1, type 2, gestational, all the rest. They're brilliant guys, and they've always seen the value in digital media and digital communication and storytelling, all the kinds of things that we're really passionate about. And so as soon as the COVID-19 crisis hit, they were very, very keen to start talking directly to their community in this part of Southwest Wales to say, this is what we're doing, don't be terrified, this is how to use our hospital services. Because, you know, basically we as users of the NHS need to know how we can interact and what we must do. So they wanted to get those messages out that if you've got a problem, you still need to go to hospital, you still need to use the NHS, don't store it up till it's too late. So there were those kind of messages. And there were also messages about when to go to, when and how to access a hospital. And it's if you think that you've got coronavirus and that you are becoming very unwell. So my very last shoot was to film on a sort of grassy knoll opposite the back entrance of the hospital and interview the staff. And we had to do all our sort of social distancing and this, that, and the other from each other. But then we were interviewing the nurses, and that was some of the first little film clips that were being done where the nursing staff were urging people to stay at home. So it was a beautiful day. And it was just at that point where people weren't quite getting into the whole isolation idea. So we shared a lot of messages, showed how they were preparing, showed how they divided the hospital into a red zone and a green zone. And yesterday, we're doing an application now for some funding to do some more formal filming, and to get the funding for it. And I looked on Twitter, and that over 120,000 people had seen these tweets, and I thought this was amazing, of sharing these clips from the hospital. And the films had been watched 63,000 times, and that's just in a couple of weeks. And we got stuff onto BBC News, ITV News, and commercial radio. So, you know, it's been a really exciting way of getting people working on the front line to talk directly to you and me, basically, in the community.
So this morning I was watching Good Morning Britain, and they were saying on there, I think Tony Blair was being interviewed, and he was saying that where sometimes it's being fallen down, they haven't got the government or the local health, haven't brought in the experts to do certain jobs. Now, to me, you're one of the experts who promotes, you know, does the filming and stuff like that. So I've seen some of the amateur stuff that the NHS, albeit great, it's okay, but I think it's about using the professionals, like organisations like yourself. I don't know how you can get their message out there in a nice, clean way and a very clear way, you know, because I think in healthcare, communication can be poor in some sort of areas, like, you know.
Well, I think what I found interesting is that I've been coaching the clinicians on how to film themselves. So we've been saying, like you said to me, make sure you look at the little camera on your laptop, because of course the natural thing is to look at you on the screen. So I've been showing them how to position themselves, thinking about the light coming in from a side source, so you get a bit of face modeling, not to be looking down at your laptop, to be looking across at the camera or whatever you're using, and not to film outside because of the wind noise. I bought them both microphones so that they could plug little pin mics into their iPhones. So, you know, we've been talking about, and then cutaways. So quite often you see people, they do video diaries and all they're just doing is a talking head, and they refer to this and they refer to that. So then I give them a list of cutaways, and I keep thinking, oh my goodness, these people are saving lives, running wards. And I'm going, can you get me a shot of the cleaning lady who's now working more closely with the clinical staff? Can you get me a shot, you know, and cleaning gentlemen. But you know what I mean? There's this whole list of things that they need to do. And then as I watch what they've done, then so they're starting to just do that as standard. So you're able, even though it's remote, I can't go into the red zone to film, but we're getting better. And then we edit it so that it looks as good as can be. So yeah, it's a really fantastic experience being able, but you have to have those relationships. I've been working with these guys now for 4 to 5 years. So I ping them a text, they ping me back. We've got that relationship that means we can do more.
So I know back in the day, you was, I'm just going to wind you back a little bit, how Pocket Medics sort of started. I know when I met you before, you said you worked for the BBC and stuff like that, and but then I don't know, something happened, and then you started up Pocket Medic. What was the idea? What did you think? Where was there a gap that Pocket Medic could actually feel and be useful for healthcare professionals and healthcare organisations?
Well, when I worked at the BBC, I made documentaries, but also I was part of the BBC Comic Relief team. So every other year, as it was at that time, we'd make all the films for Comic Relief. Oh, it was every year, wasn't it? And then Sport Relief happened, and then Comic Relief became every other year. So I would spend 3 or 4 months a year out in Africa or India or South America making films for Comic Relief. And when you're working and filming in local communities, because we were mostly concentrating on rural communities, poor communities and living in rural areas who had little or no access to sort of standard healthcare. And in those areas, the people who were on the ground were like a community health worker. So in the same way as you've set yourself up as this pain guru and somebody that people can access and talk to, a community health worker would get some sort of rudimentary training in whatever it was, whether it was malaria or infant diseases and things like that, so that they could be the one that was the focal point in every community. And I was thinking, as I was making these films to raise money for Comic Relief, gosh, if only I could be making films for these community health workers, because we're making films about mosquito nets to tell the stories back home, but wouldn't it be brilliant if she had these films in Swahili or in whatever local language people would, Telugu or something, that would help people understand how to use mosquito nets better, protect their families. So that's how I started off, thinking. I tried and tried and tried, and I still, before I hang up my filming shoes, I really wanted to do that. I'm always looking for opportunities to work in Africa or India, but you've also got all the problems of internet. As soon as you start talking about reaching poor rural communities, you've got all the infrastructure challenges. But anyway, I was back here and talking to Dr. Sam Rice from Halvar University Health Board, because I met up with him and was telling him about what I was trying to do. And he said, look, before you try and solve the health challenges in rural Africa, could you help us in rural Wales? Because he said, I've got tens of thousands of people living with type 2 diabetes who I can't reach, because anyone with type 2 diabetes is referred by a GP to go on an expert patient course. I think it was something like 65% of all patients are referred. But guess how many people actually take up a place on an expert patient face-to-face course? In Wales, in the last diabetes audit, it was less than 1%. So you've got, and that's not just because people can't be bothered, it's because people have all sorts of challenges. If you live out in the middle of Carmarthenshire or back, there's not always a bus that's going to get you there. You might be living with pain or another chronic condition that means you can't get to these courses. So his vision was to work with us, and that's what we've done. And now we're reaching, it's slow. It's always slow trying to drive change. But by the end of last year, we were reaching 22,000 clicks were made on our films. And this year already, in the face of the crisis, we've had 12,000. A lot of which have been in the last couple of months, because we've basically been pushing out on Twitter and anywhere else we can our links saying, come to our library. And I've given you the link, actually. You can put it up on the screen.
Yeah, we'll do, yeah.
pocketmedic.org/links. So we've made all our library open for use for anyone who wants to look at the films we've made.
So you've been helping out with diabetes. What other health conditions have you been working on over the year?
One of the biggest pair are diabetes and lymphedema. And lymphedema has been a really good one, because there's not a lot of, we find, talking to the lymphedema therapist, that there's a low awareness of lymphedema amongst clinicians as well as people. They don't always recognize what's going on with their body, because it's not a massively well understood condition. But lymphedema services have improved dramatically over the last couple of years. So we've made films about all aspects of lymphedema. We've just made 6 short films about genital lymphedema, which is another really difficult condition. But if you've had an operation and you've had your lymph node removed in your groin, you're at high risk of genital lymphedema. And that's what I think film is really, really important, because it's a tricky thing. You're not really going to want to rush around talking about something like that. And especially if you start to have swelling and symptoms down in that part of your body, it can be really embarrassing, particularly for some people. So I like to think that these films, if people can find access to them, they can have a look at them and think, oh, okay, oh, I'm not the only person in the world to be experiencing this. And they can identify, and that's the purpose of everything we do. We try and get people to share stories so that other people can feel less alone. And you can do it in the privacy of your own home by clicking on a link on your mobile or a laptop or a tablet. And if you're not sure how to do it, you can ask one of your grandchildren or neighbours' kids if they can help you, because that's what anything I can't ever do on the computer, I talk to my children.
So a couple of last questions before you go. Have you got, since we did our filming, I'm trying to think, I've just been sitting here trying to think when it was. I think it's got to be around 2016, 17, I think, when we did a video. I'll have to check, but I don't know if you know this, but since then we've, in the pain world, it's gone a bit bananas really, because we've got, I'm only going by what I read in papers that that they publish. The BMJ said that we have 28 million now in the UK living with pain, and we've got 500,000 people stuck on opioids. So, I mean, I'm all about self-management. What a person can do for themselves. I mean, do you know if there's any plans to make any more pain management videos?
No, but those statistics are really shocking. So what we need to do, Pete, is work together to get some funding so that we can make some supportive content about that.
Do that. I'm gonna, when I'm allowed to stand in the street with me money back or something. No, let's work on that. That sounds like a good plan.
It does, especially around the opioid crisis, because it's very well publicised, and we've seen the stats and the figures in America, and I suppose often what happens in America follows on here. Listen,
in America, mate, it's totally bonkers. Here, I think 500,000 is bonkers, and I did write to our Health Secretary, Matt Hancock, and I actually felt I tweeted him one Sunday night, and I said, "No, you won't read this, but we need to do something." He said, "Oh yeah, send me an email," which I did. I sat down the next day and sent him an email. And guess what? I've never heard back. But I mean, to have 500,000 people stuck in opioids, I mean, they're not cheap. Oh, the treatment of pain isn't cheap either. But the problems that people have being stuck on opioids. I was watching a TV program last night from Australia, where they've got the same problem over there. But even now, we love him or hate him, but even old Trumpy over there in America, he's put in, I think, over $100 million into finding new ways to how do we get people off of opioids sort of stuff. So, for him to do that, that's a massive shift as well. So yeah, let's think on that one. It's Action Planet. I suppose my last question is what's your sort of take-home message for people watching this who want to do make films, etc. Give me like two or three. What's the two or three take-home messages or pluses about making a video to help people and healthcare clinicians?
I think there's the story is king. So talking to people who are passionate about driving change, sharing their story is number one. Number two, I don't think technology should be the be all and end all, but it does need to be watchable technically. And there are some very simple things you can do to make things look as good as can be. And that's particularly like we're doing in the circumstances now. If you're going to shoot it on an iPhone, there are things you can do to make it really good as opposed to looking rubbish. But if your story's strong enough, that will still trump the technology. And the third thing, I think, is to make them with passion and love for the people you're making them for. So I always think, I'm making a series about dementia at the moment, and both my mum and dad are living with dementia. And I care about dementia so much. I care about my parents, and I care about everyone else who's living with dementia, their families and whatever else. So don't think too much about the money. Obviously, you've got to fund it, but follow your passions in communicating these messages.
So I think, I know that when you say, "Oh, well, we haven't got the budget," you know what? I always remember when I worked in the NHS, I remember talking to someone from, then they had strategic health authorities. And I said, look, these guys, you know, they're not keen on doing self-management. And they said, well, and this, she was quite high up in the health authority. She said, Peter, they can't afford not to do it because the monies they're spending on treatments will far outweigh the cost of making a movie or promoting self-management. Kim, it's been lovely talking to you, seeing you again. I still have fond memories of that time up in Newcastle, doing Gateshead, I think it was.
It was.
Doing a video, and let's do another one, especially on the opioid stuff and things like that. Let's put our thinking heads on now and get some funding in. It's much needed, you know. So the thing is, people can't move on, they can't learn unless they're well informed, and I think that's what your videos do. They inform people to move on and take more control, get people back in the driving seat. That's what I like.
Excellent. Well, thank you, Pete. It's been a real pleasure to talk to you, and yeah, let's keep going. Let's keep working on it together.
Sweet. And last message to viewers, thanks very much for watching. I'll see you again on another Paint Toolkit interview. Be cool and groovy. Take care. Ciao.